Knock knock. I'm gonna wash my hands. Good morning, Paige.
Morning.
How are you? My name is Camilo Dilaver. I am the treating physiotherapy today. How are you feeling?
Not too bad, thank you.
That's great, Paige. Is that alright if I have a seat here?
Yeah, go
Cool.
for it.
Thank you. Paige, so I can know that I'm with the right patient, would you mind telling me your full name, date of birth, and age, please?
Yeah, I'm Paige. I'm
37.
37 years old, and my birthday is October the 20th, 1952.
That's great, Paige. Thanks for sharing that with me. As you can see here, this is an exam situation. There's my assessor X and Y that will be assessing me. Is that okay for you?
Yeah, that's a good.
That's great, Paige. Have you been in physio before?
Not really.
What about Melbourne Hospital? Have you been in physio
Oh,
there?
yeah, that's it, yeah.
That's great. So just let me refresh a little bit the memory and let you know how my session is gonna look like. First part is gonna be hands-on assessment. The first part is going to be me asking you a lot of questions. The second part is going to be hands-on assessment. We'll be planning some goals together. And the third part, we will be doing some exercises. How does it sound to you?
That sounds good, yeah.
Sounds great. Thanks, Paige. So I got from your history here that you have been diagnosed 15 years ago with relapsing remitting multiple sclerosis. Is that correct?
Correct, yeah.
And apart from that diagnosis, there is no other medical condition.
No.
You had 54 doses over the last 5 years of natalizumab. That's correct.
Yes.
And because there was new symptoms over the last 6 months, you was admitted to the hospital. They did plasmapheresis. They did dexamethasone, which is corticoid. Then you went to inpatient rehab for that started 2 weeks ago.
Yes, correct.
Is that correct?
Yes.
All right. So I also got from your notes that you live with your husband and your 2 kids.
Yes.
The three of them are working full time and they are really supportive.
Yes.
And also you work as a receptionist in a daycare, so probably you want to come back to that.
Exactly, yeah.
That's correct. All right. Also got from your history that your house is a single-story house with no steps, no ladders, and you already had the occupational therapist to assess your home.
Yes.
Is that right?
Yeah, correct.
That's great. Yeah. So apart from that page, I would like to know if a few things before we can go ahead. Okay, is that okay for you?
Yeah.
Cool. Paige, do you smoke?
No.
What about drinking alcohol?
Sometimes on the weekends.
Sometimes on the weekend. How often would you say is that?
Every second weekend maybe, but nothing too hectic.
All right. And what about how many
Drinks like
drinks do
maybe
you have?
like 2 or 3.
2 or 3. All
Yeah.
right. All right. That's fine, Paige. Is there anything that you maybe think you could consider to lower it a little bit down? Because alcohol is or reducing the intake of alcohol is really good for your overall health. So that could add up to fasten up a little bit the recovery.
Right. Yeah, we'll
You
try.
know about that? Well, anyway, I know it's not too easy, Paige, but there is a lot of resources available. So if you want to think about it and yeah, give it a shot, maybe you can come back to me, let me know, and I can put you in contact with,
Yeah.
engage you with that sort of support. Good, Paige. I would like to know what things are you available to do, by your own?
Can do a lot of stuff. I just feel pretty weak now, so to walk I feel like very fatigued. So I'm like currently using like the frame
Mm-hmm.
to be able to walk, and yeah, I really want to get rid of that.
The forearm support frame.
Yeah, because it's very annoying, but yeah.
What about getting dressed and getting undressed? Are you struggling with that?
Yeah, a little bit. I mean, it take ages, but I think I can do it.
All right. And what about going to the toilet and having showers? Are you feeling that you're struggling with that?
Well, I have a chair, and so like with that is a bit easier. Still like not normal, but getting in there.
All right. So you can fully independently go in and out of the shower, walking with your forearm
Yeah,
frame.
because it's just flat, so I
Mm-hmm.
have the forearm and also like a little chair
Chair in there. All
for
right.
shower.
Cool.
Yeah.
So overall, you're still being independent. You are not able to work too much, and probably fatigue is something that concerns you because it's stopping you. This fatigue is stopping you from doing your daily activities. Is
That's
that correct?
correct. Yes.
All right. And what about how much are you able to walk now without having needing to have a rest?
Like I don't know, like after 10 or 15 minutes, like doing something, I need to like take a break and like reset myself and then like keep going.
All right. Fair enough.
Mhm.
So 10 to 15 minutes of any light duty like walking
Yeah, like
inside.
to yeah, like I mean, I don't feel like it's a line duty. I feel like it's just hard for me to do all the stuff.
All right. And what sort of stuff would it be?
I don't know, like cleaning the house is very tough for me. Like I'm trying, but yeah, I just take it easy and like stuff like that. When I'm at work, it's not too bad because I'm pretty much sitting all day. And but sometimes yes, I need to like do other stuff. At the moment, I'm just like being very flexible with that. Take it easy, but I'm just like want to get better.
Yeah, no. And in regards to your job, you already told me you spent most part of that day sitting in a chair,
Yeah.
which is not too bad in terms of your the demands, the physical demands that your work puts on you. But what about getting in and out of your job? How do you get there? Do you drive
Yeah, my husband drive me there.
and picks you up as well?
Yeah. Or like
So,
I take an Uber if I'm like.
and are you okay from the drop off place to get into your work position? Are you okay with that?
Yeah, it's
Not
not a problem.
struggling?
Not too bad. Yeah.
Alright, but now you're in a sick leave now.
Yes.
That's correct. And you're still at home now.
Yes,
You're
yes.
not more in the clinic. Is that
Exactly.
correct? That's great. That's alright. So, in terms of your previous level of function page, so before getting into the hospital and when you were able to do your stuff, what sort of things were you able to do?
Uh, I was working like more independently. Now without this, like it just feels like it's everything. I've been deteriorating so much the last 6 months, and but yeah, like it's most of a mobility, like being able to like take over 15 minutes walk, stuff like that. I feel like I'm just get tired more easily.
Mm-hmm.
And but yeah, before I used to be like definitely more independent. So this is why I'm a bit scared now. Like if this gonna be my like current level of function or like how if we can improve together. I don't know.
Well, Paige, as you probably know, because you have been with this diagnosis of relapsing remitted multiple sclerosis,
Yeah.
somebody already give you some hints of education in terms of this pathology. But anyway, let me just refresh a little bit a few points on that. Relapsing remitting means that the multiple sclerosis or the neurological symptoms rise a peak and then goes down a little bit. You know
Right.
what I mean? So you can come back to your sort of previous level of function or as close as possible. That's our main goal in patients with relapsing remitting with multiple sclerosis in broad terms. All right. So uh, symptoms should come to how you previous was. You know what I
Okay.
mean?
Yeah.
All right. So fully independent in the last 6 months ago, you were fully independent. You were able to do your shopping, drive, and stuff like that.
Yes.
And since since 6 months to till today, you found yourself like struggling more with your daily activities. Probably, from what I am understanding, fatigue is the main goal. The
Yeah.
main thing that is stopping you from doing your daily activities. Is that correct?
Yeah, maybe my also my working has been affected a lot. I think it's because the same thing, but yeah, like in the frame is it's very nice because I can have more support, but it's so like it's huge to just like being around. It's very uncomfortable. I used to use like a crutch sometimes, just one. I'm not sure if I'm able to do that now, but that would be my one of my goals to just have less support so I can have more freedom for using like my hands or something.
Yeah, that's all right, Paige. So, I'm just gonna ask you a few questions, weird questions, but those are like sort of questions that will tell me if I need to dig further in any other broad terms of medical conditions. All right.
Right.
So I'm okay if you can just answer yes or no. That's fine for me. Okay. Have you ever experienced any sudden weakness in any side of your body?
No.
Something sudden? No. And any sudden loss of sensation or alteration in sensation in one side of your body?
No.
Okay. What about any unremitting headaches? Or worst headaches, the worst
No.
headaches?
No.
No. What about? I know you have been having some problems with your slurred speech. Probably your words are not being articulated very fluently, and
Yeah.
you have been having problems swallowing.
Yes.
Is that correct?
Yes.
That's something that I want to talk with you in a few minutes. What about chest pain or any unremitting pain in any side of your body,
No.
cough. What about sweats or night sweats or chills or fever?
No, nothing
Any problem with
recently.
your bowel or bladder?
No.
No, that's okay. So, Paige, in terms of your slurred speech and your the history of choking, have you visited already the speech therapist?
Yes, I saw her like 2 weeks ago, something.
All right.
That's
So, but she
probably.
already assessed you, and there is a plan for you to work
Yes.
with her. With the
Exactly. We're working together. We
ah,
just
that's
started
great.
though.
That's great, Paige. So, in broad terms, Paige, would you mind me asking what are your expectations in terms of your physiotherapy sessions or your physiotherapy treatment? What are you expecting from you know?
Just know what things I could do, like either at home or here, just to like start to get better.
All right. And what are you expecting from just today's session? What are your expectations? What do you want to achieve today?
Well, if I can like get rid of the frame, that would be great.
All
But
right.
I don't know.
So probably having a look to your balance test, having a look to your overall balance and coordination, and see if you are suitable to change from the frame maybe to two crutches.
Yeah, that would be even like yeah, that would be
That
good.
would be something that you consider.
Yeah.
Have you been experiencing any sort of pain?
Um, Not much at the moment, no.
Have you been experiencing any sort of feet catch, or you feel like your feet is getting caught?
No,
No,
no.
that's all right. That's great. So I think that I have an overall picture of how your life looks like. So I would like to go now for my hands-on assessment. Is that all right for you?
Yeah.
That's great. So as the new lesions are in the cerebellum, that means that the cerebellum is the part of our brain that controls the smoothness of the movement, the coordination, and also the proprioception. The proprioception is how our body tells the brain in which position the joints are
Okay.
and the limbs are. So probably that's why you have been found yourself with less balance, with less because at the end of the day, the information that goes from our feet, joints, limbs, extremities, trunk, goes to your brain, goes to that part that is called the cerebellum, and the cerebellum processes it and gives the hints or the orders to the part of the body to move smooth. Sounds logical to you? Make sense?
Yeah, makes sense.
All right. So I will like to know if there is any problem with your sight or hearing.
Okay.
Have you experienced that?
Oh no.
All right. So can you see me clearly? No
Yeah.
double vision. All right. What about can you follow my finger with your eyes without moving your head? I'm not expecting any nystagmus. No?
No.
No nystagmus. Great. So, and you can see me clearly and you can hear me properly. Is that all right?
Yeah, correct.
Cool. So, what about your upper limbs? Can you raise your hands as far as you can? All right. What about here? Great. What about elbow extension? Great. Can you do this for me? Great. What about the hands? Now, I want you to do this for me as fast as you can. Yeah. As I told you, this is something that the cerebellum tells us to do. So the smoothness and the ability to make it fast it's affected. So that's coordination and perception. All right.
Yeah.
All right. Can you do chicken wings for me and hold it? Hold it. Great. What about to the front? Hold it there. Great. Hold it there and don't let me push you down. Yeah, not too bad. And don't let me push you up. Great. Can you do this movement for me? And keep it there. Don't let me twist your hands. Great. And now palms up and leave it there. Leave it there. Great. Can you squeeze my hands? Good job. Good job, Paige. Alright, are you comfortable sitting there? Can you sit a little bit up a little bit more upright?
Yeah.
That's great. Okay. So close your eyes please and let me know if does it feel the same?
Yeah.
Feel the same?
Yeah.
And what about here? Does it feel the same?
Yeah.
Alright. Keep your eyes closed and let me know if your thumb is up or down.
Up. Down. Up. Down.
Alright.
Up. Down. Down. Up.
Great. Open your eyes. Now as I can see here, your coordination and your perception is also affected. But that's something that I expect from, multiple sclerosis and the affection of the cerebellum. Alright? There is just one more test that I want to do with you, which is trying to touch your nose and finger as fast as you can. As fast as you can. That's alright. Change your fingers, change your hands. Okay, that's alright. Thanks for that page. Now I want to go over the lower extremities. There is no problem with your strength, sensation, which is great on your upper limb. So I want to check your lower limbs. Is that okay for you?
Yeah.
Alright. Now if you want, you can lay a little bit down, just if you want. And now get your knee up toward the ceiling, as up as you can, as high as you can, as higher. Just one, just one, just one. Leave it there. And what about the other one? Up, 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 up. Great. Knee extension. Great. This knee extension. And now wiggle your feet up and down for me, please. Just the feet up and down. That's okay. Now, get your knee up toward the ceiling, please. Just the knee up. Yep, and hold it. Don't let me push it down. A little bit up. Don't let me push it down. Alright, what about here? One more time. Hold it there, hold it, hold it, hold it. Great. Knee extension. And don't let me push it down. Knee extension. Don't let me push it down. Don't let me push it down. Okay. Now up and down with your feet. Great. So, last thing, close your eyes please and let me know if this feels the same.
Yes.
Does it feel the same?
Yes.
Does it feel the same?
Yes.
Does it feel the same?
Yes.
Okay, great. Now, keep your eyes closed and let me know if your um, feet, your, what do you call this?
Big toe.
Big toe is up or down?
Down. Down. Up. Up.
Right, other side.
Up. Down. Up. Down.
Great, good job. Now the last part of this assessment is gonna be take your heel to your shin and rub your shin with your heel and try to make it as fast as you can. Great. That is part of what I was expecting. You know that the smoothness of the movement is not quite good, so that's because the cerebellum is affected, but the good thing is that we have a lot of things to improve and a lot of information to improve.
Yes.
Make sense to you?
How we can do that?
We're gonna work on the coordination, we're gonna work on the proprioception, on your balance, because that is going to help you to rebuild the pathways to your brain.
Right.
All right?
Yeah.
So we need to reteach or moreover your brain needs to relearn how to move again.
Okay.
Make sense?
Yes.
Great. Now I want to see how do you stand up by yourself without the, you know, the frame. So can you stand up by yourself?
Oh.
It's hard.
I never tried.
No, you can try.
Right.
I'm gonna just 1 second, Paige. I'm gonna use this. This is called a pelican bell. I'm gonna put it just around your waist. Waist? What do you call this?
Your waist.
Waist. Just around your waist. So this is a safety precaution because this is the first time that I see you. Okay?
Right.
Alright. Try to stand up at the count of 3. 1, 2, 3, up. 1, 2, 3, up. It's too hard.
Oh yeah. It's too low.
It's too low. Yeah, no. Try to stand up a little bit and I'm going to put a cushion under your bottom. Probably now you will find easier.
Yeah, maybe yes.
1, 2, 3, up. Alright, great. Yep, go back. Go back. Great. So, as you could see, your both knees were buckling, were giving way. So, it's not safe to stand by yourself. I'm gonna take this forearm back. As you could see now, Paige, I know you want to get rid of, you know, the forearm the forearm support frame, but it's not safe for you at this stage, basically because the strength of your knees is not good enough to support you. You will need your upper limbs to assist you with the gait. Make sense to you?
Yeah.
But the good thing is we're gonna keep in mind um, your goal of getting rid of the frame to work on your strengthening this in the strengthening of your lower limbs and also get rid in the future sessions of this frame. Sounds
Yeah,
great to
that's
you?
good.
All right. So now holding on the forearm, on the forearm support frame.
Right.
Stand up again, please. One more time. Great. Great. Remember that the frame is there for you.
Right.
Feel better.
Yeah.
All right. What about if you do some marches on the spot? All right. Can you raise your right knee for me, please? Left one, right one, and hold it up. Hold it up. All right. Just one more time, and I'm gonna try to know how long do you, how much time. Right. Keep it there. Keep it up, up, up. Now one. I'm gonna try to count on 1, 2, 3. All right. What about the right one? Something just on the left. 1, 2, 3. All right. 3 seconds and 2 seconds on the left. Okay?
Mm-hmm.
Try to do this for me. Put your left feet there and hold that position without having to hold on. 4, 5, 6. All right. And what about the right one? Go with the right. Yep. And leave it. Get, lose your hands. 1, 2, 3, 4, 5, 6, 7, 8, 9. All right. 9 seconds and 6 seconds on the other side. Okay? Now the last one, this is going to be really difficult, so put your feet right in front of the other one. And try to keep that position as long as you can. When you lose your hands, I'm gonna start counting. All right? 1, 2, 3. 3 seconds. And what about the left one in front of the right? 1, 2, 3. 3 seconds. Okay, that's great. I think that I missed one thing with your feet, so can you come back to the plinth for me, please? Because I'm seeing a few things on your feet, and I want to check them. All right. Now, extend your knee, please, for me. Get your feet up for me, and hold it there. Hold it there. Great. Push my hand. Push my hand. Other one. Same thing. Put your feet up, and don't let me push you down. Wow, that's great. And push my hand. Push my hand. Good job. All right. Fair enough. There is a slight uh, reduction in the strength on this side of your body, on the right side. So yeah, we will work on your strengthening, coordination and proprioception. And the last thing that I want to assess with you is your gait. All right, so we can check properly how are you walking and if there is an improvement that we can do. All right.
Right.
So now stand up. Feeling tired?
Yeah.
Too much? Like
No, I can.
you need a rest, or you can
Try to walk.
you can try to walk. All right, fair enough. So take a walk for me, please. and have a seat on this chair that is on the left side, on your left side. Alright, the pieces before did a time up and go for you, and the last time you scored 30 seconds. I'm expecting to be at least on the same time frame, or get a little bit better. That means that the time that takes you to go to the 3 meter mark and come back and have a seat is less than 30 seconds. Alright?
Yeah.
Sounds good? So, we're going to do the same time up and go that the physio did before, and I'm going to take how long does it take to stand up, go to the 3 meter mark, come around, turn around, come back and have a seat. And I'm going to stop the time when you are sitting properly. Okay?
Okay.
Alright, so are you ready now?
Yeah.
Okay, now 1, 2, 3, up. 4, 5, 6, 9, 10, 13, 15, 16, 20, 21, 22, 23, 23 seconds, which is great. There is a big improvement compared with the last physio session. I could see from your gait pattern. Where are you going?
Just here having a rest.
Just having a rest?
Yeah.
That's alright. So, Paige, if you can give a score, try to give a score from 0 to 10 of how tired are you feeling, how fatigued are you feeling. So how much would you rate now?
Like a 6.
Like a 6. Alright, not too bad. I mean, I know you need to catch your breath back. So in the meantime, Paige, there's a few things. If you can have open your eyes and have a look to me.
Alright.
Alright. So there's a few things that we can improve on your gait. The first thing that I want to start training with you is, what is it called? Heel contact.
Right.
Alright? So what does it mean is each time that you give one step, try to land on your heel. Okay? And try to keep your feet up for me. Up.
Right.
Okay?
Yeah.
Alright. What about the number now?
It's getting better, maybe like a 4.
Alright, let's go for a walk another
Right.
walk. Alright, Paige,
Same
take
thing.
your time.
Same thing.
Same thing with the frame, but remember, I want you to give each step, try to land on your knee, on your heel.
Alright.
Alright? Great. 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 Much better.
You want me to do it quicker?
If you want to go quicker, that's fine, because that is gonna exert you a little bit, which is something that we want. Alright, we want to work until 6 or 7 of the numbers that I gave you of your fatigue, but not go over that. Great. That's much better. Remember to land on your heels, especially with the left one that you are missing, and try to give a little bit longer steps. Great. Good job. Alright, have a seat back in the chair, please. Alright, how does it feel?
Like good.
Feels good?
Yeah.
Bit tired?
Yeah.
Not too much?
I can keep going a bit more.
Alright, so, Paige, first thing that I notice is, obviously I already commented that on you, but there is weakness in your lower extremities,
Yeah.
and we need those lower extremities work with enough strength so you can get rid of the assistive device.
Right.
Alright, so the first thing that I want to start working with you is try to strengthening your knee, your lower extremities.
Okay.
And we're gonna get that by doing some sit-ups from the chair.
Okay.
Alright, so um, come back to the chair. Let me know how tired are you feeling now?
Yeah.
What is your level of fatigue now?
5 after the walk.
Can you walk?
Yeah, 5.
5. Alright, keep in there.
Right. I'm ready to go.
Alright, when you feel like you're in a 4, that's fine. We can start working again.
Okay.
Alright?
Should I sit in this chair or the lower one? The lower one.
Let's try with that one in the meantime, because that is really low, so I don't want to over, you know.
Right. I'm gonna start. How many do you want me to do?
We're going to count how many you can do in 10 seconds.
Okay. I'm ready.
No, 30 seconds, sorry.
I'm ready.
Are you ready?
Yeah.
Alright, so this probably should be a little bit lower, but that's fine. We're going to count how many of these sit-ups you're... Wait a minute. Get back so I can give you the instruction. So it's gonna be 30 seconds and I'm going to count how many sit-ups you can do in 30 seconds. Okay?
Okay.
Great. Now 1, 2, 3, and we got 1, and we got 2, and we got 3, 4, we got 5, 6, 7, and 8. Great. 8 sit-ups in 30 seconds. That's really good. We are gonna keep that in mind and we will be comparing these 8 sit-ups in the future sessions. Okay?
That's good.
Sounds good to you? Alright, so now, because there is marked weakness in your lower extremities and we already did some exercises here, I want to take the chance to do these exercises while you are in the clinic. Alright? So, do some knee extension here for me, please. Extend your knee up as you can, up, and hold it there 3 seconds. 1, 2, hold it there. 1, 1, 2, 3. Alright. And the other one. 1, 2, 3. Alright. Right one. 1, 2, 3. The left one. 1, 2, 3. So Paige, this is gonna be the first exercise that I want you to do at home. Yeah. And you're gonna do it at least 3 times a day. If you can do 2 times, that's fine. Hopefully 3 times.
Okay.
Alright? Now, right one. This is gonna be 10 times. Getting full knee extension, remember that, and holding the position for 3 seconds.
Right.
Make sense?
Yeah.
Alright. Keep it there. Come on, Paige. Good job. The other one. Alright. And the right one. Alright. The left one. The right one. Left one. Right, the right one. And the left one. Good. Now, what I can see from your this exercise is that there is, what is it called, extension lag.
Right.
That means that your knee is not being fully able to get the last degrees of knee extension. So what we are going to do now, and this is going to be your second exercise to make at home, is roll a towel under your knee. Can you sit a little bit more straight there? That's fine.
Right.
So you got it? There is a towel rolled behind your knee,
Yeah.
and you're going to do just the last movement. Alright? Hold it there 3 seconds and then release 10 times. 1, and remember, hold it 1, 2, 3, and then go down. 1, no, you're not understanding me. 1, 2, 3, and then release. Make sense, Paige?
Yeah.
Wake up. Are you feeling better? Are you feeling okay?
Yeah.
Alright. 10 times. And hold it 3 seconds. Now, go. 1, 2, 3. Great. Good job, Paige. Again. 1, 2, 3. Better. Again, please. 1, 2, 3. Release. One more time. 1, 2, 3. And the last time. 1, 2, 3. Great. Up your knees. Alright. 10 times with the left. 1, 2, 3. Release. Again. One more time. 1, 2, 3. 1, 2, 3. Come on. Be supportive. Be supportive. 1, 2, 3. 1, 2, 3. And then release. 1, 2, 3. Hold it. Good. You're waking up now. And the last one. 1, 2, 3. Great. How are you feeling?
Yeah, good.
Feeling great?
Yeah.
Okay. Bend your knees, please. And this is going to be the third exercise that I want you to do at home. It is called bridges. Alright? And why is it called bridges? Because you are going to lift your bump out of the plinth.
Okay.
Hold it 3 seconds and then come down.
Okay.
Alright?
Yeah.
Go for it. 1, 2, 3. Go down. One more time. 1, 2, 3. Go down. 1, 2, 3. Go down. 1, 2, 3. Go down. And up. 1, 2, 3. Hold down. That's 4. Up. 1, 2, 3. That's 5. Again. 1, 2, 3. That's 7. 1, 2, 3. That's 8. 1, 2, 3. That's 9. And 1, 2, 3. That's 10. Great, Paige. How are you feeling there?
Good.
Feeling great?
Yeah.
How is your level of fatigue now?
4.
Okay, sounds good to me. So I just want to compare now your muscle strength. I'm not expecting much improvement, but a small amount would be great. So can you flex your knee for me, please? Up, 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 up. And hold it there. Don't let me push it down. Don't let me push it down. Right. Now, hip flexion, keep it there. Don't let me push it down. Don't let me push it down. Right. Now, do one kick for me. Kick, 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 kick. Great. What about the other one? Up, 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 up. Great. Good job. Now, push my hand. Great. And push my hand. Good job. Push my hand. Push my hand. Good job. Much better, Paige. Good job. Now, we're going to do the same exercise than before. The time up and go. Go to the 3-meter mark and come back. Alright? And we're going to compare with how it was in the first time.
Okay.
Okay, let's go. So as I told you, it's not safe for you to get rid of the frame. All right. So we will be keep walking with this device. All
Okay.
right.
Yeah.
All right. Go for it. 1, 2, 3. Time started. 6, 7, 8, 9, 10, 11, 12, 13. Great. Good job, Paige. Well done. You are doing. You have done a great job today. I just want to know if do you have any questions for me now?
How often should I should do this by myself at home?
Yes, you can do this by your own at home. You can walk as much as you can, but with the the forearm frame.
I must as if I do it more, I will get rid of the crutches then. I mean
Uh,
of the.
yeah, for sure. I mean, as much as you can, as much as you can, as much as your fatigue allows you, try to walk as much as you can into the house. Yeah, that's all right.
If I
And
got fatigue, is it good to keep doing it?
it's okay as long as you don't go over 6 out of 10.
Okay.
All right. So don't get too overexerted because that's going to not benefit you.
Okay.
Okay, makes sense. And also, I want you to keep doing these exercises at home.
Every
The
day.
three, try to do at least 2 times a day. If you can do it 3 times a day, that's better. The
Yeah.
more exercise you do, the more we gain strength, the easier or the faster we get rid of that support, forearm support crutch.
Okay.
Sorry, forearm frame.
If I'm vegetarian, is that affect in any way?
Um, because this is out of my scope of practice, I think that going back to your GP, if you're concerned about that, I'm more than happy to write a letter to your GP and see how your GP can engage you in contact with probably a dietitian or a nutritionist that can give you some help in terms of your food intake and your nutrition. How
Okay.
does it sound to you?
Yeah, it sounds good.
Sounds good?
Yeah.
Okay, so today is Thursday. I want to see you again on Monday
Right.
next week, alright? And keep doing the same exercises
Every day,
every day, at least 2 times a day. If you can do it 3 times, that's better for me.
Okay.
Alright? And
Sounds
it's gonna
good.
be better for you.
Sounds good.
Alright, Paige?
Thank
Now, see you later, alligator.
you. Thank you.